Bill, social programs aren't the problem, and this isn't a fight for social justice. For some it is, but not for all. This is also about fiscal repair. You know that health care was a train wreck waiting to happen. There had to be reformation, and if it wasn't, there wouldn't just be a repeal and rewrite by Republicans. It would have been repeal and throw it out entirely. Wars are the problem. Wars are the problem. Is that socialistic? Is the military socialistic?
Wars are a problem.
Wars are costly.
There's no doubt that Iraq and Afghanistan and the war on terror in general has deflated the Treasury enormously, and we have to fight smarter in the future. I agree 100%. But I disagree with you. Obamacare is all about social justice. That's what it's about. Okay, it's about setting up a system where everybody is guaranteed the same health care. Everybody's guaranteed that. Whether you have a lot of money or no money, you're going to get the same health care. Now, in theory, that sounds good, all right? But in practice, we got a $14 trillion deficit, debt that we can't pay off. And this is going to add to it big time. Go.
Again, the reality, and you know my husband's a doc, you have more and more emergency rooms closing throughout the United States. Less doctors graduating from med school, less colleges entering pre-med students, less doctors being hired. That is going to be a problem physically and financially down the road for the United States of America. This is not just about social justice, it's about fiscal responsibility.
And you think that Obamacare is going to encourage more people to get into the medical profession and more emergency rooms to open their doors? You're crazy. People are bailing like they don't want the feds telling them what to do. That's what's going on. That's the erosion. If you open it up to a fair market system, and I didn't say free market, I said fair market system, you'll regain some momentum. I'll give you the last word.
What's fair about you living somewhere, hypothetically, where you can't get to an ER if you have a heart attack in an 80-mile radius because they've closed? Move.
Right.
I mean, not everyone can do that. The have-nots can't necessarily.
You said what's fair about it? If you want good medical care, move to where it is. But the government is not going to be able to level the playing field in this. It's going to fail, just like it failed in Amtrak, and it's going to cost us gazillions of dollars. Leslie, thanks very much. We appreciate it.